Lumbar paraspinals, low back muscles. Okay, we see people with low back pain all the time. It's not necessarily because of the low back muscles themselves. That's why you go to PT, so somebody can evaluate and more accurately find what's happening mechanically that may lead to stress in the low back. But it's not necessarily only originating in the low back. That said, taping the low back can take some of that edge off, and it's extremely effective when the low back muscles or the lumbar paraspinals are the origin of the dysfunction or are the origin of the pain. So let's learn how to tape them. Go ahead and cut the anchor for your first strip. Have it ready. Cut the anchor for the second strip. Okay, so now you peel off the paper for your anchor. You want to anchor pretty low, so just above the glutes or just above the buns. Give it some friction, help it stick. I usually use an individual's waistband as my guide. And this is something you can do too. It's a little trick if you don't feel comfortable really touching somebody in this area, is put the tape on and then rub it but over the clothes. Okay, both anchors are on. I'm going to peel up to my top anchor, give it some stretch, some serious stretch, and then no stretch on that top anchor. Good. So peel that paper off till you get to about 1 inch from the top. Pull it all the way up and then adhere it. Okay, one thing to note, it was hard to see, but I did have him bend forward while I applied the tape to, again, stretch the muscle out. So again, for the lumbar paraspinals, you use 2 eye strips. Get your anchor ready for your first strip. Get the anchor ready for the second strip. Peel that paper backing off. Apply your anchor, no tension, just below the waist on the high glutes. Rub, rub, rub. Give it some friction, help it stick. Peel the paper backing for the anchor on the second piece of tape. Apply that anchor. Rub, rub, rub. Okay, have the patient or client bend forward, stretching the muscles out. Peel the paper off till you get about 1 inch from the top. Add a lot of tension. Stick the tape onto the skin. No tension at the top. Give it some friction, help it stick. Peel the paper off till you get about 1 inch from the top. Patient is still in flexion. They're folded forward. Add a lot of tension to that tape and then no tension at the top. Give them both some friction, help them stick. Patient sits back up. Ta-da! Low back taping.